Imagine a world where a child dies every few seconds for a preventable disease, not because medicine doesn't exist, but because access does not. Good morning and afternoon, my dear friends and teachers. Today I am speaking about Sustainable Development Goal 3, good health and well being, a goal that determines whether humanity progresses through or leaves millions behind. Health is not just the absence of disease, it is the foundation of education, economic productivity, innovation, and human dignity. Yet, according to the United Nations, only about 17% of SDG targets are currently on track, meaning the promise of good health for all is in a serious danger. As WHO Director General Dr. Tedros said, health is not a cost, it is the smartest investment any society can make. Because when health fails, everything else collapses. On to our next slide. Achieving good health is not about hospitals alone, it is about systems. First, universal health coverage, ensuring no one is denied treatment because they are poor. Second, primary and preventive care, stopping disease before it starts. Third, mental health, which has moved from the shadows to the center of global health discussions. Fourth, emergency preparedness, because pandemics have shown how fragile our world really is. Despite progress, the WHO estimates that 400 million people still lack access to essential health services. Former WHO Director Margaret Chan warned that without strong primary care, even the most advanced hospitals cannot save a nation's health. Healthcare systems are like foundations, visible, but everything depends on them. On to next. But health is not built only in clinics, it is built in daily choices. What we eat, how we move, how we sleep, how we manage stress shape our future more than any medicine. Today, lifestyle related diseases dominate global mortality. In 2021 alone, non communicable diseases caused 43 million deaths worldwide, diseases that are largely preventable. Former WHO leader Gor Hallam Brundtland captured this perfectly. Prevention is not only better than cure, it is the only sustainable care. Healthy citizens are more proactive, creative, and resilient. A nation's true wealth is not in the GDP but in the health of its own people. We now face a paradox of modern progress. Technology has advanced, yet diseases of lifestyle are rising. Cardiovascular diseases alone killed nearly 20 million people in 2022, making them the world's biggest killer. At the same time, preventable child deaths continue in 2023. About 4.8 million children under 5 died, mostly from causes we already know how to prevent. Mental health disorders are also increasing rapidly, especially among young people facing academic pressure, digital overload, and social isolation. Public health expert Dr. Tom Frieden warns that the greatest tragedy is not that these diseases exist, but that most are preventable. The world does not suffer from lack of knowledge, it suffers from lack of implementation. Now, if health systems are the foundation, individuals are the builders. Simple actions can dramatically reduce risk. Eating balanced diets, staying physically active, avoiding tobacco, getting enough sleep, managing stress. Tobacco alone kills more than 8 million people every year, proving that behavior is one of the strongest determinants of health. Lifestyle medicine's pioneer Dr. Dean Ornish demonstrated that heart diseases, once considered are irreversible, can actually be reversed through lifestyle changes. This means the power to transform health is already in our hands. Now, on to our next slide. However, people make healthy choices if they lack information. They cannot make it. Health education transforms awareness into action. It teaches communities about nutrition, hygiene, mental health, vaccination, and disease prevention. Vaccination campaigns are a perfect example. They prevent 4 to 5 million deaths every year, according to WHO. Dr. Fulio Frank emphasized that education is the most powerful medicine because it prevents suffering before it begins. When people understand health, They protect not only themselves but entire communities. Knowledge in this sense becomes a vaccine. Now, there are some challenges in promoting health. Despite solutions, the road to SDG-3 is filled with obstacles. Healthcare inequality means millions still cannot access doctors or medicines. The world faces a projected shortage of 10 million health workers by 2030, especially in developing countries. Misinformation spreads faster than viruses, undermining trust in science. Climate changes is creating new health threats, from heat waves to emerging infectious diseases. Public health expert Sir Michael Marmot stated that health inequality is not inevitable, it is the result of policy choices. In other words, poor health outcomes are not accidents, they are consequences. So, what does SDG-3 really ask of us? It asks us to build a world where health is a right, not a privilege. A world where no child dies from preventable causes, where no family falls into poverty because of medical bills, and where mental health is valued as much as physical health. Former WHO Director Hafdan Maher once said that health for all will remain a dream unless people demand it as a social goal. SDG-3 is not just a global target, it is a moral commitment. Because in the end, the measure of progress is not how fast we advance, but how many people we carry forward with us. Thank you. Before thank you, I would like to give the references for here, like United Nations SDG Report 2024, World Healthcare Organizations, WHO, NCD, CVD, UHC Tobacco Reports, UNICEF Child Mortality Report 2023, WHO Immunization Coverage Data, WHO Health Workforce Projections and all. So a very warm thank you from my side. I would like to end this video session, and informative I suppose for you all. This information